So we should clarify first that we were very specific in the modes of delivery that we were comparing when we looked at the neurodevelopmental disorders among children in this analysis. We wanted to look at the group of individuals who cannot achieve a spontaneous vaginal birth. So most births occur spontaneously without need for intervention, but not all do. In fact, in Canada, most, I wouldn't say, so in Canada, among first-time moms, about a quarter of first-time moms will not deliver spontaneously and will need to have assistance in that delivery to facilitate a birth. And so we looked at that quarter of the population that requires intervention. And when that occurs, there's a few different options available. The first is you could have a cesarean delivery. So that's when you've labored, there is no opportunity for the birth to occur vaginally without intervention. And so the decision is made to have a cesarean delivery when the woman is fully dilated. They're called second stage cesarean deliveries. The other option is to try to assist that delivery to happen vaginally using a forceps or vacuum or a combination of those two instruments. We call that group of interventions assisted vaginal deliveries. And so when a person is, again, planning to deliver spontaneously, they're fully dilated, but for whatever reason, whether it be a maternal indication or an indication because of some kind of fetal distress or a worry about the fetus, then we decide to use one of these interventions. So what our analysis was specifically looking at, depending on which of those options you select, what is the risk of the infant to acquire some of these neurodevelopmental disorders, in particular ADHD, autism spectrum disorder, and intellectual disability. And so maybe I'll hand it over to Maya if you wanted to tell us what the results of our analysis showed.
Yeah, so overall, our results were pretty reassuring in that we found similar rates of ADHD, autism, and intellectual disability within those different groups that Dr. Muraca outlined. We did find some modest differences in terms of a slightly higher risk or rate of ADHD among the people who had a forceps and vacuum delivery, so those who required both interventions, as well as people who underwent a vacuum assisted birth. There were some higher rates of intellectual disability there too. But overall, the magnitude of those differences were pretty small. And so it is a little bit reassuring to know that these outcomes or these interventions seem to be pretty safe in terms of neurodevelopmental disorders.
What we should add, Celeste, is that because it's quite difficult to study this group of people and to find data on large populations that you can use to give you robust and reliable results when looking at these different interventions and comparing these interventions, there really is, even though these assisted deliveries, whether it be by cesarean or by these assisted vaginal instruments, even though they're quite common relatively, we don't really have much information about what each option means for these long-term health outcomes for the baby. So it was one of the big reasons for us wanting to delve deep into this question. The other reason is that previous research has really focused on comparing cesarean deliveries with vaginal deliveries without understanding the big differences between lumping those two things together into big groups. And so because of that, previous research has shown that children's neurodevelopmental outcomes based on type of births are showing that cesarean delivery has higher rates of some of these neurodevelopmental disorders. But what we're showing is that when you actually compare apples with apples, that we're not seeing those big differences. So instead of attributing some of these negative neurodevelopmental disorder outcomes to cesarean deliveries at large, our study is saying you have to look a little bit closer and understand make sure you're comparing apples to apples before we assign a mode of delivery like cesarean delivery to be a cause of some of these disorders. I guess the key takeaways would be this gives both clinicians and families clarity about navigating delivery decisions when you're in that critical stage of being fully dilated, having a trial of labor, but requiring an intervention in this area where evidence has really been limited and impeded by the fact that we've been using inappropriate comparison groups. Oh, that's a great question. So I think one of the things we'd like to do is expand to looking at other neurodevelopmental and behavioral disorders. We were interested in looking at things like cerebral palsy and epilepsy, for example. There's also a lot of interest in understanding really what some of the kind of factors that would be actually more strongly associated or correlated with these neurodevelopmental outcomes that occur during labor. So we focus on mode of delivery, but there are a lot of other things that occur during the labor and delivery and really in pregnancy overall that we know are probably a component to why these disorders why they occur. So, for example, there are things like studying the duration of labor and other things, for example, looking at the combination of different interventions versus things like physiologic birth. So there's a lot of avenues for research that we are kind of, I would say, considering when we think about further delving into the question about what during pregnancy and during labor and delivery could be one of the root causes of these disorders.